Good morning, everyone. It is Friday. It's Red Friday, September 9th. And if you can't tell, yep, it's the first Chiefs game this weekend, Red Friday. It's the kickoff to the season. Thanks so much for being with us here on Facebook, YouTube, and on Twitter. Of course, the best part of a Chiefs game is always the win, of course, but tailgating and the food, certainly a close second. So we've got an easy and, yes, kind of healthy recipe ready for the game. Ever wonder how the health system became the official healthcare provider of the Chiefs? Chiefs President Mark Donovan and our CEO and President Bob Page reminisce and talk about why and how it all began. Plus, we'll take you behind the scenes and tell you how the best fans in the stands get the very best healthcare during the game. Yeah, so it's not just Red Across Chiefs Kingdom here in Kansas City, but we're getting in on it here in the studio too. And these seats right next to me, they will not be empty for long. They will be filled with some really fun guests coming up here in just a few moments. So stay with us. But the Chiefs, of course, take on the Cardinals Sunday in their first regular season game, and we have got a lot to get to this morning. First up, two people who remember very well when the Kansas City Chiefs chose the health system to care for its players, their families, and the fans. They are Chief President Mark Donovan and Health System President and CEO Bob Page. I caught up with both earlier this week. Mark, I just want to start with you. What excites you most about this upcoming season?
Well, it's a really exciting time of the year for us just because we've gone through the preseason and it's time to play for real. And when you've had the success we've had most recently, the opportunity to compete for a 7th straight AFC West championship, the opportunity to potentially host a 5th straight AFC championship at GHA Field. It gets us excited internally. I know it gets our fan base excited.
Yeah, I think you speak for all of us. Bob, I know it doesn't take a lot to get you excited about sports, especially Chiefs. So what are you most looking forward to this season?
Well, I think it's what Mark said. I mean, we've got what a great team. A lot of new faces this year. Had a chance to go up to training camp and see some of the practices. It's a great group of guys. We love our relationship with the Chiefs. I think it's time for football. Everybody's ready to go and time to get the season started.
So the University of Kansas Health System and the Chiefs, we know, have had a long-standing relationship. Kind of tell me a little bit about that story. How long has it been? Who wants to start?
One of the things that makes this relationship as strong as it is the foundation. For Bob and I to sit down, and frankly, my first meeting with Bob was just to pick his brain on how he was able to accomplish with his team all he had done in really resurrecting the hospital system. And I wanted to learn. And that turned into some conversations about how we could partner and how we could benefit each other.
Actually, Jess, I have a memory of, I got a call that Mark Donovan wanted to meet with me. Mark had just come to town, and I was like, why in the world would Mark want to meet with me? And we struck up this friendship. I think our first meeting was at the old Houston's down on the plaza. We started this conversation, and we realized there might be something between our two organizations, and we just kept the conversation going. And the beauty for us was that healthcare in professional sports wasn't very well organized in Kansas City.
Mark, you mentioned it a little bit, but Bob, tell me, what does it mean for the University of Kansas Health System to be the official healthcare provider of the Chiefs? We hear it, we see it, but what does it really mean?
Well, I think it means a couple things. One, it means that the Chiefs organization trusts us with these incredibly talented and valuable assets they have called players. And so if we're able to prove that we can take great care of professional athletes, then we can also prove to the community that we can take care of the student athlete and we can take care of the weekend warrior. And that's been the strategy all along for us.
So Mark, elite care we know extends to those Chiefs fans. So why did the Chiefs decide early on to include fan care?
I think one of the really important parts about this partnership is the approach to be comprehensive, and comprehensive in our partnership in every single level of what we do, but also comprehensive in healthcare. So including our fans was a pillar of our initial discussion. And we have both learned a lot about each other. I think the health system has learned about what it takes to care for 75,000 plus people on a Sunday or a Saturday or a Thursday or a Friday. And over this past 11 years now, we've each gotten better and better at it.
Bob, same question to you. Why is it so important for the University of Kansas Health System to include those fantastic Chiefs fans when they're out there at the stadium?
Well, I think, Jess, it's all about the experience, right? I mean, when you're coming to a game, nobody ever thinks they're going to need health care, but if you're going to need health care, we came in, as Mark said, this was not a marketing deal. This is truly a comprehensive approach. We want to take care of the players. we wanted to take care of the staff, and we wanted to take care of the fans. And we knew if we could do all of that, that would truly cement the partnership we have with the Chiefs.
Well, gentlemen, thank you so much for joining us today. Cheers to an awesome season coming up this fall. Well, doctors with the health system were on the sideline during all of training camp up in St. Joe, keeping a close watch on everything from heat exhaustion to injuries. Chiefs head orthopedic surgeon, Dr. Paul Schreppel, cares for high-level players like the pros and those elite student athletes, of course, all the way down to those weekend warriors. While all of his patients can experience similar injuries, he says there is a difference.
Yeah, the injuries on these fields probably happen at a higher velocity. I mean, you've seen an NFL hit. It's really unprecedented amongst other sports, but a lot of the injuries actually are at the same at many levels. And so I think being able to care for these guys at this level really helps us take care of those sprains and strains, but also the more severe ligamentous injuries, things like ACL injuries, shoulder instability, MCL sprains, meniscal tears. So those would all be common ones that we take care of.
And of course, players are not the only ones who can become sick or injured at the game. Fans in the stands can, of course, suffer a scraped knee or dehydration or even some more serious medical conditions. And it has happened. Emergency medicine physician Dr. Dennis Allen has seen it all. And he joins us live at Arrowhead Stadium this morning to show us around the first aid station. Good morning, Dr. Allen. How are you?
Good morning. I'm really good. Thank you.
Good to see you. Thanks for getting up early and out there. You have many years of experience in emergency medicine from, of course, here at the health system and then overseeing even drivers and fan care out at NASCAR. I think we have some video of you, and there was a video where you responded to this crash that we're going to see. Yep, that was the one. You responded to that. And then last night you were just across the parking lot caring for folks out there at the Royals game. So what is the most serious condition with a fan that you maybe have had to take care of at a game or any event?
We do a little bit of everything out here. When you get this many people together and people want to come to games, they want to go be entertained, so they'll take a bit of a risk sometimes with their health. So we've seen heart attacks out here, we've seen strokes, we've seen seizures. We've had to treat some fairly critical patients, and which is why we put emergency medicine physicians in this care center.
So maybe what's more of a common issue that you see? What's the thing that you see the most? And then maybe some advice on how fans can avoid coming to see you and missing the game.
Yeah, I think that clearly our most common complaint is probably just they want some treatment for headache, which is fine. I think as far as when we have to evaluate people, we see a lot, especially early in the season, a lot of heat related. And because we all know from sports medicine literature that the hotter it is and the more people are there, the more patients you're going to see. And I think that hot, being hot and not taking care of their hydration and probably not taking enough break from drinking alcohol to drink a little bit of water puts a lot of people in our care center.
Well, I would imagine they've got a pregame just like the players do, at home before you come down, make sure you're staying nice and hydrated, get that water going just in case you do forget. But you mentioned, more serious issues like heart attacks. And, we think about it, some of these fans are out there 5, 6, maybe 7 hours, out in the parking lot and coming in. So life just happens. I mean, anything can happen, we know, in that short of time, right?
It absolutely can. And people, they want to get out. They want to get back to their lives. I saw a gentleman at a game that we evaluated that he was 4 weeks out of 3 stents in his heart, but he wanted to come to a game, so he did, and that's why we're here, so that he can come enjoy himself. If it becomes a bit much and he needs help, we're there for him.
Yeah, that's great. So people can enjoy the game and get back to life. Okay, so this is not your typical first aid station when we think of it, like a little metal box with Band-Aids in it. This is like a mini hospital, Dr. Allen. So can you kind of show us around and show us what's inside? Take us behind the scenes.
Absolutely. So first, where we're located is right off of section 114 in the stands. So that's why we call this station 114. But this is where you find us. There's 7 first aid stations in Arrowhead, but this is our biggest. And this is where we'll guide our more complicated patients down into here. Out in this area is where EMS is the entire game. If we need to transport somebody, they're right here to help us out. You're greeted immediately when you come in, and then this is our shop. We can do complicated patients. We can do stabilization of almost anything in here if we have to. Like I said, this is our biggest station, but this is one of 7 that we have at Arrowhead.
So, Dr. Allen, if somebody were needed to be taken to, like brought here to the health system, how do you work with emergency services to make sure that patients can get that higher level of care? I mean, we're at a game, it's very crowded. How do you get them out of your space and ushered down to emergency services? Sure.
Well, and actually the same service, which is Kansas City, Missouri Fire Department, is that transports the patients from here, are also responding in the stands. So we have radio contact with them throughout the pre and the game and the post game, and a lot of times one of their supervisors is right here. So if anything comes from security, from that somebody needs help, the Kansas City, Missouri Fire will go and do the original triage of the patient, and many times this will be their destination. If we feel like they have to go to the hospital, and that's warranted, and we don't do that much, we probably transport 3 patients a game out of here to a hospital. If we feel like they need that, they're right outside the door. They come in. They're probably, if they need to go to the hospital, they're probably not in this first aid station more than 20 minutes.
Dr. Allen, just last question. For anyone who is out at Arrowhead watching the game, enjoying it, and starts to maybe not feel well or has some sort of episode, just tell us exactly what needs to be done. Who do they need to reach out to? Who do they need to notify so that they can find Section 114?
Sure. I mean, the best thing for somebody to do, and what we've found most effective, is there are all kinds of fan help and security in the stadium. They're all over the place, and just ask one of them. Just say, I've got somebody that needs help, and they will radio EMS that's within the stadium. We're hearing that on the EMS radio here in the stands. So I think just the fan help people that are here, and security that are all over the stadium is probably the best person to just say, hey, I've got somebody that needs help to get things started.
And I would imagine, look out for each other. Fans are friends, and if you see something, say something. If you see somebody who might need help, just reach out and make sure that they can find you, right?
And that's how we do most of it. Somebody saying, I saw somebody in the bathroom that I think needs help. I mean, that's how it happens.
All right, Dr. Allen, so good to see you. Thank you. Thank you for being here and helping us kick off Red Friday.
You betcha. Thank you.
Thanks so much. Okay, well, as we've been talking about it, Red Friday officially kicked off at 5 o'clock this morning. The Chiefs teamed up with the Ronald McDonald House Charities to sell these red flags. So we've got these red flags, and you can get them at the McDonald's drive-thru. So You see them hanging around our studio. They're very, very cool. The money for the Ronald McDonald House in the sale of those $5, that money goes to help support families of sick children with their travel and housing costs. So hit up a McDonald's on your way in or way out today, and hopefully there will be some still available. Let's get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us now. So what about COVID this year in the stadiums? Over the last couple of years, this has been a big deal. We get these questions from the community. Any recommendations, Doc, on your end, or are people over it? Are they just back to Chiefs and going to games?
Yeah, I mean, I think there's a lot there. First of all, I think people are over it. But again, we also need to make sure that you as an individual understand your risk. We want to certainly protect the most at-risk people. And that really does mean being up to date with vaccination. Also understanding those situations you're going to. I think we've always really promoted those outdoor events, whether you're walking around the parks or in a stadium like Arrowhead. We do understand that the outdoor, all of that ventilation, those turbulent airflows are really much safer than those indoor spaces. So, and again, if you do feel uncomfortable, it is always appropriate to wear a mask. So, but I think overall, for the most part, because of the setup of Arrowhead, you are going to be fairly safe because of just all that airflow and that ventilation there. So
make sure you have your vaccinations,
yeah,
as you always say. Let's get to our COVID count and then followed by monkeypox.
Yeah, so right now in the hospital, 22 active infections with 5 in the ICU, 2 on the ventilator, still 16 in that recovery period. Again, case counts have been going down nationally, hospitalizations nationally. We are kind of static as far as number of active infections, but hopefully that will trend down.
And monkeypox.
Yeah, so monkeypox, again, what we have seen is that recent slowing of those cases. And I think overall that's a good thing. I think that has to do with education. We also know that more people are aware of it, but also, of course, vaccination is helping as well. So overall, continues to be good as far as case counts go. Still have very few cases here in Kansas, quite a bit more, but still less in Missouri than a lot of other places where we've seen higher trends of cases as well. But hopefully we will continue to see a decrease in cases and really stem the tide of this outbreak.
All right, from the Journal of Neurology today, a new study finds elevated biomarkers say that those who get COVID-19 may now have a damaged nervous system and inflammation. So just what could this cause? What should people know?
Yeah, I think this is a good observational study. As you know, we know that long COVID is an issue, will be a health crisis. Really, certainly if you have it, it's a health crisis for you. It's a good observational study. It certainly would support one of the reasons we think people get long COVID, and that is some sort of chronic inflammatory process. We are still trying to learn about the pathophysiology, elucidate those real mechanisms as to what's causing it, but this is a good observational study to support that. Now, how does that fit into the context of, number one, prevention, but also treatment of long COVID as we move further into this?
How are you liking this day where you don't have to wear your white coat?
Yeah, it's good. I'm supporting Red Friday,
Yep.
so
all right.
We got to make it through this weekend, but one step closer to whooping the Bills and the Bengals again, and trying to get back to that Super Bowl. So
Let's do it.
Yeah.
Let's do it. Doc Hawk, thanks so much. We'll see you in a bit. Okay, do we have any reporter questions on the line today? Okay, well, we're going to get to our next guest. He is one of the Chiefs fans. We love him. We just love him. He's such a great guy. One of the most aggressive defensive players in history. Sean Barber joined the team back in 2003 during his time with the Chiefs. He racked up more than 150 tackles, 6 sacks, had 3 forced fumbles. Okay, I don't know all those stats, but I know you, and I just like you. How are you, Sean Barber?
Man, I'm doing great this morning. Obviously, Red Friday to kick off the awesome run back to a Super Bowl. We're going to start it in Arizona week 1 and hopefully end up back in Arizona for the Super Bowl.
And you brought a little friend, big friend.
He's been following me around for the last few days, man. I don't know what's going on with Wolfie.
He's the best.
Yeah, I gave him a couple of washes, bathed him off, and dried him off, so he smells good today.
It does smell good, but you missed a spot because I'm telling you right now, I don't know if you can get a one shot on Wolfie, but put your neck up because you got some lipstick on your
my
face.
goodness.
Lipstick. So I love it. Right. Sean, you're here for a reason. That's to help us all kick off. I love you. So just Give me 1 second. Okay, so just what does Red Friday mean to Kansas City? Why does it it's just the best, and it just kind of gets us ready for the wins?
It's a way to signal off a true culmination of all the blood, sweat, and tears those players put out up in St. Joe's at training camp. Everybody's putting together their biggest and best to kick off a great season and want to make sure they do, the two things that we know we're going to get. Tremendous effort and tremendous attitude out there on the field.
Well, you brought up training. What was it like? Training, what's it like? I was curious thinking about when you've gone through a game, even when you maybe had a game where you didn't take any big hits, like how long does it take you to recover physically from just playing in a pro game?
I think about a 48-hour window. I mean, for 2 days, your muscles are kind of, a little bit atrophied, the dehydration. You definitely want to hydrate. Like, I've learned so much today just listening to the first half of the show about how to prepare yourself as a fan for the game, and it's similar on the field. We want to make sure that we're well rested and hydrate. But when you talk about the recovery period, you got to flush out all that them toxins out of your muscles so that you can prepare for the next week's game.
Right, you don't have a whole lot of time. You got to get right back up on it, and you have to stay hydrated because you are out there running and gunning it out there on the field. So I know I'm one of those people when he comes out, Sean, I kind of geek out when the wolf comes out. I'm sorry, but that's just how it goes. Do you have any cool like superstitions when it comes to games? Is there anything, or is that like, we don't really do that? But do you have to wear like the same underwear, the same socks, the same this, the same that? You do, I know.
Yes,
you wear the same underwear every time.
They're always washed, but yeah, you do find after a victory, you want to keep the same, maybe keep the same look, same swag going into that next game. You want to make sure your socks are the same height and maybe the same colored gloves, whatever it is. Just
the same swag.
Oh man, just in case. You never know. Some guys think it matters, some guys don't, but in case it does, you want to make sure that you give yourself every chance to be victorious on Sunday.
Do you ever eat anything or don't eat anything to
I think
give
it's
you
high
the edge?
carbs, a lot of pasta and stuff, protein, the chicken and stuff like that. Pre-game for the Chiefs, you want to give the guys, something so they're not going in the game with a full stomach, but enough fuel and energy to last them in case we go to overtime.
And exactly. That's going to happen. What does he eat?
Oh, so Wolfie's actually been on the same diet Frank Clark's been on. So he gave up the alcohol, gave up the red meat.
I can tell.
Most of the red meat.
Good. Good.
But he's ready for some Raider meat. He's ready for some Bronco steaks.
Yes, delicious.
And a little bit of Charger
barbecue
souffle.
Charger. I love it. I love it. So how excited are you for this particular season?
Well, I mean, obviously it's a way for us. I'm so excited for our defense. We got a lot of youth on the defense side of the ball. And then, obviously, I want to see what happens with our offense. I want to see what is the next page, right? Tyreek Hill's out the building. We had, new receivers, Juju and MVS coming in. And then Sky Moore, man, this guy, I think, the sky's the limit. And I think everybody's overlooking Miko. Miko is a weapon to be used in many ways with Andy Reid's offense. So it's just as the page turns and we see another chapter of Andy's extensive offensive set, and then his defense is going to be sneaky good. So I think we'll get up into the top 10 on the defense.
Sneaky good. That's a good analysis. Let's watch it all play out. Do you have some good moves? Do you have some new moves you're working on this year? I know, you're good. I know, you shake it. I love it.
I think Whoopi's going to save it for game day. Obviously, we got that quick turnaround, right?
Get stretched out, get ready. Yeah, save your moves. I love it. Are we Super Bowl bound?
We are always.
Can I say that? Can I just ask
you
it?
can put it in the air. We always are ready for that next ring. It starts on Sunday against the Arizona Cardinals, and then we have that quick turnaround. So when you talk about rest and rehab and hydration, I mean, it's so important, especially on that short week. So it's 2 games going back-to-back here. We got to take care of business and start the season 2-0.
All right, let's do it. Don't go anywhere. You both have to stay here with me, okay? But we're going to get to this. Fans have superstitions, as we were just talking about, rituals of the things they wear, the things they eat, and, of course, the cheers that they shout out and chant when they're watching the game. And just like the food that we will consume, the cheering can be a cause of great regret when it's all over. Ear, nose, and throat specialist Dr. Shannon Kraft joins us to explain. Dr. Kraft, good morning to you. So tell us, is there really can there be some real damage when it comes to screaming too loud, too suddenly? Is this really something people should be concerned about?
Yeah, it's real. Fortunately, most of the damage we sustain after a particularly exciting game and we're all cheering is temporary and reversible. Most of us are going to experience some strain in the muscles in our neck and some level of vocal cord swelling or edema. But with particularly aggressive vocalization, you imagine the guy with the full-throated, full-body strain as he's screaming, or repetitive use of the voice, it's possible to sustain a more significant injury, such as a vocal cord hemorrhage, or injuries that result in polyp formation or scar formation, which could be more problematic.
So what would be the sign? We go to a concert, we go to a game, we're yelling in front of our TV. Would there be anything, if maybe it lasted more than a couple of days, of a hoarse voice? Is there something that we should be looking out for that knows that we might need to come see you?
Yeah, absolutely. So, you point out there's the signs and symptoms are going to be there for a day or two, right? Some mild aching in the front of the neck, maybe some raspiness or roughness to the voice, but that really should resolve within 1 to 2 days. And it certainly should not last more than 2 weeks. So if you have particularly concerning symptoms, such as a complete loss of voice, significant pain with voicing, or if your symptoms of voice change have lasted more than 2 weeks, that's the time that you want to see someone, an ENT or a specialist, to examine your vocal cords.
All right, Doc, we hear what you're saying, but it is certainly going to be hard once those Chiefs take the field and we see them play to lower our voices. I don't know about those inside voices, but just last question for you. So if there is ever damage to a vocal cord, is there any way to, reverse that damage or fix it, make it better?
Yeah, so it's kind of a two-step process, right? Just like Mr. Barber was talking about rest and rehab. So if you've had a great game and you've been shouting and cheering the boys on and you notice those changes the next day, that mild aching, those voice changes, it's time for fans to rest and rehab, rest that voice. Avoid shouting, yelling, singing, try to limit long phone conversations or talking anywhere you might be talking over loud noise, right? Give the voice a rest. Hydrate, hydrate, hydrate. Just like our athletes, right? We want to make sure that our patients and our fans are hydrating. That's very favorable for vocal fold recovery. And we do want to try to limit things that are going to irritate the vocal cords. That's going to be things like caffeine, alcohol, smoking, which includes vaping. All of these in and of themselves can be injurious to the vocal cords and certainly are going to slow your recovery. Now, if you have those concerning symptoms that we talked about before, or your symptoms less than 2 weeks, that's when you want to engage someone like myself or my partners, Dr. Garnett or Dr. Kavukshin, or even your local ENT. And we're going to use a small camera at that point to kind of take a look down and see what the damage is to your vocal cords. Fortunately, a lot of the treatment is medical and behavioral modification. If indicated, we may use some steroids. Sometimes we use some anti-reflux medications. Sometimes we engage speech-language pathologists to help rehabilitate the voice. Rarely, but occasionally, surgery is indicated, and it's the case we work with our patients to get them back to good voicing.
All right, everyone, you heard it here. Dr. Kraft just gave you some great advice, so we are going to try really, really hard to take your advice, Doc.
Thanks so much.
Thank you. Great to see you this morning. Thanks for being with us on this Red Friday. Well, what's a good football game without the tailgate, without the great food? This Red Friday, we are cooking up a healthy app, okay? We got to make it healthy. You know how we are. Chef Eric King, the Assistant Director of Dining Services here at the Health System, is here with his yummy take on sweet potato bites and paws off. You got to wait. Chef Eric, how are you?
I'm doing fantastic. I know he's given up the red meat, but...
He is, but this is good. Little vegetarian. And I have to tell you, people say, oh, come over and watch the game. I'm like, yeah, the game sounds fun. What are you making?
Well,
what's on the menu,
right? Here, these are our loaded sweet potato bites. Really simple recipe. Sweet potatoes tossed with a little bit of olive oil, kosher salt, chili powder, garlic. Bake it for a little bit. Top it with some Monterey Jack cheddar cheese, a little bit of hot sauce, sour cream, and some green onions.
So you can make it, you make really good stuff. And you sent me like this big list of all these healthy apps. I was like, they don't sound healthy, but they really were. They're so great and delicious.
Yeah, you can use low-fat cheese. You can sub out low-fat sour cream. My wife last night, I made these. She said, could we do this with some balsamic vinegar and some goat cheese tomorrow? And I said, of course we can. So
there you go.
However you want to dress it, we can do it.
See how you did that? I know. Lucky wife. Okay, thank you, because we're going to try those. The three of us are going to try them.
Definitely.
You're in. We're going to put the ingredients up on the pretty simple ingredients, though. Just if you want to take a peek at that, click on it, and you can make those for your next tailgate or next game. So take a look at that, and we're going to pass that. Let's pass that plate around a little bit. Pass the plate around, and then I'm going to ask you to maybe save a little bit of room for this. Let's check this out, because this is the newest, stop it. This is the newest food option at Arrowhead. It's a Dorito-encrusted empanada. It's made with ground beef, onions, cheddar jack cheese, and avocado crema, all surrounded by crushed up Doritos. Yum. You can find it at the concession stand in section 111. You'll also be able to get some yummy barbecue, of course. barbecue brisket fries, barbecue chili crunch nachos, quesadillas. Are you going to have one? Can I eat one, guys? Yeah, good. Yeah, okay. Oh, okay, I'll wait. I'm going to wait. You eat one. You try one first, and then I'm going second. Finally, this morning, a live look at the Truman Sports Complex, where the Royals begin an exciting sports weekend here in Kansas City. But even more important, tonight is Breast Cancer Awareness at the K. Did you know about 1 in 8 women receives a breast cancer diagnosis in their lifetime? So staff from the University of Kansas Cancer Center will be at Gate A to help answer all your questions. You'll learn more about breast cancer with an interactive quiz, plus why 3D mammograms are so important in early detection. Okay, let me try one. Okay. Did Wolfie get one?
Wolfie has, no, this is not on his diet. I'm sorry.
Not, it's only, oh, that's right. Bronco meat, barbecue bronco meat for you.
And that's supposed
Love
to be,
it.
that's healthy for you? That's what's good?
It is. See, I'm telling you. Thank you, Chef. Always good to
My
see
pleasure,
you. Thanks
my pleasure.
Thanks for that this morning, and thank you so much for being with us. Sorry, do not talk with your mouth full of food, people. But don't forget, you can catch our updates anytime by logging onto Facebook, YouTube, and Twitter. Go out and make it a fantastic weekend. Have a great Red Friday, and we'll see you back here live at 8 on Monday.
Coming up Monday on the Morning Medical Update, 16 million adults experience chronic back pain.
I couldn't stand for a half hour anymore. It was altering my lifestyle some.
I'm Jessica Lovell. Learn how a tiny FDA-approved device is outsmarting his pain and getting him back on his feet. That's Monday at 8 on the Morning Medical Update.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.